Hello and welcome. Today, we're diving into a common yet often misunderstood condition, gastric polyps. We'll explore what they are, what causes them, how they're diagnosed, and what you can do about them.
So, let's get started.
What exactly causes these polyps? The etiology of gastric polyps is complex and varies depending on the type. In many cases, chronic inflammation of the stomach lining, often due to Helicobacter pylori infection or autoimmune gastritis, is a major culprit. Other factors include the long-term use of proton pump inhibitors, or PPIs, which are medications used to reduce stomach acid, and genetic predispositions, such as familial adenomatous polyposis, or FAP. Understanding these causes is the first step in managing and potentially preventing the formation of gastric polyps. Now, let's talk about what's actually happening inside your stomach when these polyps develop. The pathophysiology of gastric polyps involves an abnormal growth of cells on the stomach lining. Inflammation triggers the body's repair mechanisms, and sometimes, these repair processes go awry, leading to the formation of excess tissue. This excess tissue manifests as polyps. The specific cellular changes depend on the polyp type, ranging from benign hyperplastic changes to more concerning pre-cancerous or cancerous transformations. It's the type of cellular change that really dictates the clinical significance of a polyp. Let's consider how common gastric polyps are. Epidemiology studies show that they're present in approximately 6% of the adult population, based on endoscopy findings. However, many individuals with gastric polyps are asymptomatic, meaning they don't experience any noticeable symptoms, so the actual prevalence may be higher. Certain groups, such as older adults and people with chronic gastritis, may have a higher risk of developing them. While gastric polyps are frequently found, the majority of the cases don't need aggressive treatment or become cancerous. So, how do you know if you might have gastric polyps? Well, many people experience no symptoms at all, and the polyps are discovered incidentally during an endoscopy performed for other reasons. However, when symptoms do occur, they can include abdominal pain, nausea, vomiting, bleeding which can lead to anemia, or, in rare cases, obstruction if the polyp is large and located near the stomach outlet. It's important to remember that these symptoms are not specific to gastric polyps and can be caused by other gastrointestinal conditions. But if you experience them, it's important to seek medical attention. The primary method for diagnosing gastric polyps is through endoscopy. During this procedure, a thin, flexible tube with a camera attached is inserted through the mouth and into the stomach, allowing the doctor to visualize the stomach lining. If polyps are found, a biopsy, or tissue sample, is usually taken and sent to a lab for analysis. This biopsy is crucial in determining the type of polyp and whether it's benign, precancerous, or cancerous. This information guides subsequent treatment decisions. Gastric polyps are not a single entity. There are various types and we can classify them. We have hyperplastic polyps, the most common type, typically small and associated with chronic inflammation. Then there are fundic gland polyps, often linked to PPI and usually benign. Adenomatous polyps, which are less common, are considered precancerous and require careful monitoring and potential removal. Finally, there are inflammatory fibroid polyps, which are rare and often associated with injury or inflammation. Correct classification is important for making the correct treatment decision. Treatment for gastric polyps depends on their type, size, and whether they're causing any symptoms. Small benign polyps may not require any treatment other than regular monitoring with endoscopy. Larger polyps, or those with precancerous or cancerous features, are typically removed during endoscopy in a procedure called polypectomy. In some cases, surgery may be necessary. If H. pylori infection is present, antibiotics will be prescribed to eradicate the bacteria. Proton pump inhibitors may be discontinued or adjusted if they are contributing to the problem. Can you prevent gastric polyps? While not all gastric polyps are preventable, there are steps you can take to reduce your risk. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, is always beneficial. Avoiding excessive alcohol consumption and smoking is also recommended. If you are prescribed proton pump inhibitors, discuss with your doctor whether they are truly necessary and explore alternative treatments if possible. Lastly, if you have a family history of gastric polyps or certain genetic conditions, regular screening endoscopies may be recommended. What's the outlook for someone diagnosed with gastric polyps? The prognosis is generally good, especially if the polyps are detected early and removed promptly. Most gastric polyps are benign and do not pose a significant health risk. However, regular follow-up endoscopies are often recommended to monitor for recurrence or the development of new polyps. Research continues in understanding the underlying mechanisms of gastric polyp formation and identifying new strategies for prevention and treatment. One area of focus is the role of gut microbiota in inflammation and polyp development. In conclusion, with proper diagnosis, management, and follow-up, individuals with gastric polyps can live healthy and fulfilling lives.